How do blood thinners prevent stroke in AFib? Imagine your heart beating irregularly and rapidly, causing blood to swirl and slow down in the upper chambers called the atria. When blood moves sluggishly, it can form tiny clots. If a clot breaks free, it can travel through the bloodstream and block an artery in the brain, leading to a stroke. This is what happens in atrial fibrillation, a common heart rhythm disorder. Blood thinners, also known as anticoagulants, help prevent this dangerous process. They work by reducing the blood's ability to form clots. In people with atrial fibrillation, these medications are prescribed to lower the risk of stroke by stopping clots from forming in the heart before they can travel to the brain. The main goal is to interrupt the chain of events that leads from irregular heartbeats to clot formation and then to stroke. There are different types of blood thinners used for atrial fibrillation. Warfarin is a traditional medication that blocks vitamin K, dependent clotting factors in the liver. It has been shown to cut stroke risk by about 60% compared to no treatment. However, warfarin needs regular blood tests to monitor its effect and careful attention to diet because foods high in vitamin K, like leafy greens, can interfere with it. Newer blood thinners, called direct oral anticoagulants, include medications like apixaban, rivaroxaban, dabigatran, and edoxaban. These target specific steps in the clotting process and are just as effective as warfarin for stroke prevention. They usually don't require routine blood tests and have fewer dietary restrictions. Some studies suggest they may even lower the risk of bleeding in the brain compared to warfarin, making them a popular choice today. Deciding whether to use a blood thinner depends on an individual's risk of stroke. Doctors often use scoring systems like the CHA₂DS₂-VASc score to estimate this risk. The higher the score, the more likely the benefits of blood thinners outweigh the risks. Not everyone with atrial fibrillation needs these medications, as the risk of bleeding is also a concern. Bleeding complications, especially in the brain or stomach, are the main side effects. The risk increases with age, other health conditions, and certain medications. It's important to remember that blood thinners do not cure atrial fibrillation or fix the heart rhythm. They simply address one of the most serious complications, which is stroke. While highly effective, they require careful management. Regular checkups with a healthcare provider are essential to adjust doses and monitor for side effects. Never stop or change your medication without medical advice, as doing so can increase your risk of stroke. In summary, blood thinners prevent stroke in atrial fibrillation by reducing the formation of blood clots in the heart. They are a key part of managing stroke risk but must be used thoughtfully, considering each person's unique health profile. Always consult your healthcare provider for personalized advice and to ensure safe, effective treatment.